Heart murmurs. Heart murmurs are sounds, for example, whooshing or washing, made by violent blood in or close to your heart. Your PCP can hear these sounds with a stethoscope. A typical heartbeat makes two seems like lubbed up, once in a while portrayed as lubbed up when your heart valves are shutting. Heart murmurs can be available upon entering the world, intrinsic, or foster sometime down the road. Heart murmurs can be innocuous, guiltless, or strange. A guiltless heart mumble is anything but an indication of coronary illness and needn't bother with treatment. Unusual heart murmurs require follow-up testing to decide the reason. Treatment is aimed at the reason for your strange heart murmurs. Indications. On the off chance that you have an honest heart murmurs, you probably will not have some other signs or manifestations. An unusual heart murmurs may cause the accompanying signs and side effects, contingent upon the reason for the murmurs. Skin that seems blue, particularly on your fingertips and lips. Growing or abrupt weight acquire. Windedness. Constant hack. Extended liver. Extended neck veins. In babies, helpless hunger and inability to develop ordinarily. Hefty perspiring with next to zero movement. Chest pain, wooziness. Blacking out. When to see a specialist. Most heart murmurs aren't not kidding. However, in the event that you think you or your kid has a heart murmurs, plan to see your family specialist. Your PCP can advise you if the heart murmurs is guiltless and doesn't need any further treatment, or if a hidden heart issue should be additionally analyzed. Causes. A heart murmurs may occur at the point when the heart is loading up with blood, diastolic murmur. At the point when the heart is purging, systolic murmur. All through the heartbeat, ceaseless mumble. A heart murmurs might be honest or strange. Honest heart murmurs. An individual with an honest mumble has an ordinary heart. This kind of heart murmurs is regular in infants and youngsters. An honest murmurs can happen when blood streams more quickly than ordinary through the heart. Conditions that may cause quick blood move through your heart, bringing about a guiltless heart murmurs, include active work or exercise, pregnancy, fever, not having sufficient solid red platelets to convey satisfactory oxygen to your body tissues, sickliness, an excessive amount of thyroid chemical in your body, hyperthyroidism, periods of fast development, like puberty. Honest heart murmurs may vanish over the long haul, or they may last as long as you can remember while never bringing on additional medical conditions. Strange heart murmurs. In grown-ups, strange mumbles are frequently because of obtained heart valve issues. In youngsters, strange murmurs are normally brought about by underlying issues of the heart, intrinsic heart deserts. Basic intrinsic deformities that reason heart murmurs include openings in the heart, known as septal imperfections. Openings in the heart might be not kidding, contingent upon the size of the opening and its area. Heart shunts. Cardiovascular shunts happen when there's a strange bloodstream between the heart chambers or veins, which may prompt a heart murmur. Heart valve issues present from birth. Models incorporate valves that don't permit sufficient blood through them, stenosis, or those that don't close as expected and break, disgorging. In more seasoned youngsters and grown-ups, reasons for strange heart murmurs incorporate contaminations and conditions that harm the designs of the heart. For instance, valve calcification. This solidifying or thickening of valves, as in mitral stenosis or aortic valve stenosis, can happen as you age. Valves may get limited, stenotic, making it harder for blood to move through your heart, bringing about murmurs. Endocarditis. This contamination of the inward coating of your heart and valves commonly happens when microscopic organisms or different germs from another piece of your body, like your mouth, spread through your circulation system and stall out in your heart. Left untreated, endocarditis can harm or obliterate your heart valves. This condition generally happens in individuals who as of now have heart valve issues. Rheumatic fever. Albeit now uncommon in the United States, rheumatic fever is a genuine condition that can happen when you don't get instant or complete treatment for a strep throat disease. It can for all time influence the heart valves and meddle with typical blood course through your heart. Risk factors. You have an expanded danger of a heart mumble given that somebody in your family had a heart deformity related with the strange sounds. Various ailments can build your danger of heart murmurs, including a debilitated heart muscle, cardiomyopathy, a contamination of the covering of the heart, endocarditis, blood issues set apart by a high number of certain white cells, called eosinophils, hypereosinophilic disorder, certain immune system issues, including lupus and rheumatoid joint pain, synthetics from an uncommon tumor in the lungs or gastrointestinal framework that enter your circulation system, carcinoid condition, heart valve illness, hypertension, hypertension in the lungs, aspiratory hypertension, history of rheumatic fever, overactive thyroid, hyperthyroidism. Having uncontrolled diabetes or a rubella contamination during pregnancy expands your child's danger of creating heart surrenders and a heart murmur. Utilization of specific prescriptions, liquor or medications during pregnancy can prompt heart deserts in a creating child, which may cause a heart murmur's counteraction. While there's very little you can do to forestall a heart murmur, it is consoling to realize that heart murmurs are not an illness and are regularly innocuous. For kids, numerous murmurs disappear all alone as kids develop. For grown-ups, murmurs may vanish as the fundamental condition causing them improves.